I'm Dr. Mahanur Ehsan and today we are going to discuss diuretics, also known as water pills. These are commonly used medicines, and in this lecture we will see their classification and then the detail of thiazide group of diuretics. These are basically the medicines which induce a state of increased urine flow, and there are five main types, namely thiazide loop, carbonic anhydrase inhibitors, potassium-sparing diuretics, and osmotic diuretics. Now, thiazide diuretics are the most widely used of the diuretic group, and they include chlorothiazide and hydrochlorothiazide. Chlorothiazide was the first diuretic drug that was effectively used in patients who were having edema of cirrhosis and heart failure and that had minimum side effects. Now, the prototype and commonly used drug is hydrochlorothiazide. Chemically, these are sulfonamide derivatives. They have sulfonamide residue in their structure and they are structurally similar to carbonic anhydrase inhibitors, but they are more potent and they act on distal tubules of the kidneys. Now, very important from the MCQ's point of view is their other name. They are also known as sealing diuretics. Now, why they are called sealing? Because increasing the dose of diuretic above normal will not increase the diuretic response. So, these are known as sealing diuretics. Another very important thing is their site of action, and you should remember that they act on the luminal membrane of distal convoluted tubules of kidneys and ascending loop of Henle. They have no effect on the proximal tubules. So you must remember the site of action, and this is different from other groups. Then their duration of action varies from 6 to 12 hours and they are excreted via the organic acid secretory system of the kidneys. In this diagram, you can see there is a tubular cell and the target of thiazide diuretics is the sodium chloride cotransporter, which is located on the luminal membrane of the cell. When this transporter will be inhibited, sodium chloride reabsorption will be inhibited. Hence, more sodium and chloride will be excreted into the urine, and this is going to produce a hyperosmolar urine. Now, this is again a property which is unique to only thiazide group of diuretics. Other diuretics do not produce hyperosmolar urine. Now, this was the effect on sodium and chloride. What is the case with potassium? Now, when more sodium will be presented to the fluid in the distal tubules, more potassium will be exchanged for that sodium, and hence more potassium will be lost in the urine. So, this is going to be an important adverse effect, particularly when they are going to be used for a longer period of time. So, potassium levels need to be monitored very carefully prior to beginning the therapy with diuretics and also during the therapy. Then what is the effect on calcium? They are going to promote the reabsorption of calcium in the kidneys, so they are going to decrease calcium excretion in the urine. And by a mechanism which is not yet understood, they are also going to promote the loss of magnesium, and this is particularly important in elderly patients who are using chronically this group of drug. So they are also going to promote magnesium loss in the urine, and they have no effect on the acid base balance of the body. They are not going to affect the pH. So they are going to promote the loss of sodium chloride and potassium in the urine, and they are going to conserve calcium, and they are having no effect on the acid base balance. And how do they act then? They reduce the peripheral vascular resistance. Peripheral vascular resistance is reduced how? Because initially they will reduce the blood volume. Later on, the volume recovery occurs, and the reduction in blood pressure will be by the relaxation of arteriolar smooth muscles. So, these drugs reduce peripheral vascular resistance. Next comes the uses, and you should remember that the major role of these drugs is in the management of hypertension. They are of great value when we are treating the patients who are hypertensive. They reduce both the systolic as well as diastolic blood pressure, and they maintain the blood pressure at a lower level with once daily dosing. And they are also easily tolerable, they are orally available, they are easy to administer, and they are inexpensive. So their major role and their main concern is for management of hypertension. Next comes heart failure, and you should remember that the drug of choice for management of heart failure for reducing the extracellular fluid volume is loop diuretics. Thiazide diuretics can be added to add on the effect of loop diuretics. They are not the drug of choice for heart failure. Next comes syndrome of inappropriate ADS secretion. As we have seen that they produce a hyperosmolar urine, so this effect can be utilized for the management of patients with nephrogenic diabetes insipidus, where these can reduce the urine volume from 11 liter per day to 3 liter per day. So this is important. Then we have seen that they also promote calcium reabsorption and they decrease calcium excretion in the urine. So they are useful for patients who are having hypercalciuria and calcium oxalate stones. So the therapeutic uses include hypertension, heart failure, syndrome of inappropriate ADS secretion, and hypercalciuria with stones. Next comes adverse effects, and the most common and most important adverse effect that need to be monitored is hypokalemia. They are going to reduce the serum potassium levels, and this is very important particularly for the patients who are taking digoxin, as hypokalemia can lead to ventricular arrhythmias in such patients. So we should monitor the potassium levels, and it may require dietary supplementation by citrus fruits, dates, bananas, or it may require potassium supplements, or even it may require change of diuretic to potassium sparing diuretics. So hypokalemia is the most important, most common adverse effect which is to this group of diuretics. Then as we have seen that they reduce the blood volume, so they will cause orthostatic hypotension, which is postural drop in blood pressure, and that can lead to lightheadedness and other such symptoms. Then as the volume depletion is occurring, it will cause increased ADH release, and this will lead to dilutional hyponatremia. So potassium is going to decrease, sodium is going to decrease, the blood pressure is going to decrease, and rest of the things, they are going to be increased. Now what are they are serum calcium level. As they decrease the calcium excretion, that can lead to hypercalcemia. Then they decrease the tissue uptake of glucose, they decrease the insulin release, so they can lead to hyperglycemia, and this is important for patients who are having diabetes mellitus. Then uric acid metabolism, they will, what they do, they inhibit uric acid excretion. Now uric acid is insoluble. When it is not excreted, it will start depositing particularly in the joints, and that will lead to gouty attacks in the patients. So it can lead to hyperuricemia also. Next comes hyperlipidemia, because prolonged use can lead to increased cholesterol and LDL synthesis. So lipids and cholesterol, they are also going to rise, and rarely some patients might have allergy to sulfa group, so there can be hypersensitivity to thiazides. So sodium and potassium, they are going to fall, whereas calcium, glucose, uric acid, and lipids, they will be raised when these drugs are used for a longer period of time. Then important thing is another group which is called thiazide-like diuretics. They have unsubstituted sulfonamide residue, and they have diuretic properties, but they are not true thiazides, and they include chlorothalidone, metallozone, and indapamide. Chlorothalidone, you should remember that it is a longer acting drug, and it is used for management of hypertension in single daily dosing. Then metallozone, it is most potent of all the diuretics, particularly of the thiazide diuretics. And indapamide, you should remember from MCQ's point of view that this is a lipid soluble drug. It has a GIT excretion, and therefore it can be used in patients who are having poor renal function. So this was all about the thiazide group of diuretics. Hope you will find this video useful. Thanks for watching.